Do you ever look at your underwear and wonder, is this normal? White discharge, yellow discharge, thick, watery, smelly. What does it all mean? In today's video, I'll explain exactly what normal vaginal discharge looks like. What are the warning signs, and when you really need to see a doctor? Simple, honest, and to the point. First of all, vaginal discharge is normal. It's a fluid made by glands in your cervix and vagina. It has three main jobs: keeps the vagina clean. It naturally flushes out dead cells and bacteria. Prevents infections by maintaining a slightly acidic pH. Changes with hormones, especially during your menstrual cycle. Pregnancy, breastfeeding, and menopause. So having discharge is not a disease. The question is it normal discharge or a sign of infection? This is the normal discharge. If color is clear, egg white-like or milky white if smell is mild, not foul, not fishy, not rotten, and consistency can be watery, creamy, or slightly stretchy. This can change during the month. Around ovulation, more clear and stretchy, like egg white before periods, thicker, creamier. In pregnancy, may become more, as long as there is no strong smell, no itching, no burning, no pain. This is usually normal physiological discharge. Now, when should you be worried? You should be concerned if your discharge has any of these features. Color changes. Thick white, curd-like, cottage cheese type discharge gives often seen in yeast infection, Candida. Yellow or green discharge, especially with bad smell, can be bacterial infection or STI. Grayish-white discharge with fishy smell gives. Commonly seen in bacterial vaginosis, brown discharge gives may be old blood, sometimes normal around periods, but if frequent or with pain, get it checked. Smell, strong, fishy smell, rotten, foul smell. Associated symptoms: intense itching around the vagina, burning while passing urine, redness, swelling, pain during intercourse, lower abdominal or pelvic pain. These are not normal and usually mean infection or inflammation that needs treatment. Some common conditions that cause abnormal discharge: yeast infection, Candida, thick, white, clumpy, cottage cheese-like discharge, intense itching, burning, usually no strong smell. Can happen after antibiotics in diabetics, pregnancy, or due to tight, non-breathable clothes. Bacterial vaginosis, BV thin. Grayish-white discharge, strong fishy smell, especially after intercourse caused by imbalance of vaginal bacteria, not strictly an STI, but linked to sexual activity. Sexually transmitted infections, STIs, for example, chlamydia, gonorrhea, trichomoniasis. Yellow-green, frothy, or heavy discharge, bad odor, may have pelvic pain. Pain during sex, burning while urinating, cervical issues like polyps, inflammation, rarely cancer, persistent discharge. Sometimes mixed with blood, may have bleeding after sex. If your discharge is changing suddenly, especially with pain, itching, or bad smell, don't ignore it. You should see a doctor or gynecologist if your discharge has bad smell, you have intense itching or burning, you see yellow, green, or gray discharge, you have pain in lower abdomen or pelvis, there is bleeding after intercourse, or between periods, you recently had unprotected sex and notice new discharge. Don't feel shy. Every gynecologist sees this daily. The doctor may do a physical exam, take a small swab sample, and easily treat it with tablets or creams. Some simple tips to keep your vaginal health good. Don't wear cotton underwear. Avoid too tight synthetic ones. Change wet clothes quickly after gym or swimming. Wipe from front to back after using the toilet. Keep blood sugar under control if diabetic. Use protection. Condoms if you have multiple partners. Don't use vaginal douching or harsh soaps inside the vagina. It disturbs the natural pH. Don't use perfumed sprays, deodorants, or powders down there. Don't self-medicate repeatedly with over-the-counter creams or antibiotics without diagnosis. Remember, the vagina is self-cleaning. You just need to support it, not over-clean it. Let's recap quickly. Some discharge is normal and healthy. Look at color, smell, and symptoms. If there is itching, odor, pain, or color change, get checked. Please don't feel ashamed. Vaginal discharge is a health signal, not a dirty thing. Share this with your sisters and friends, and subscribe for more honest women's health content.